Year 2014, India was certified polio-free. Year 2015, India eliminated maternal and neonatal tetanus. From 2011 to 2020, the infant mortality rate in India went down by 35%. At the very center of all these achievements was the tireless work of India's frontline health workers. In this video, we take a deep dive into who these frontline health workers are, what they do, why they matter, and what challenges do they face. Frontline health workers or community health workers are those who take health services directly to the communities where access is limited. In India, these frontline workers are usually women who come from the communities that they are serving. In India, there are three types of frontline health workers: the Anganwadi workers, the Asha workers or accredited social health activists, and the auxiliary nurse midwife. Let's look at each of them in a bit more detail. Anganwadi workers are a critical part of the Integrated Child Development Services program, whose mandate is to provide preschool education for children under 6, nutritional support and healthcare for children and pregnant or lactating mothers, conduct regular health surveys of families, coordinate with block healthcare establishments to inform them of any cases of disabilities or infections among children. Asha workers are part-time trained health community volunteers. They form a key component of India's National Rural Health Mission. They are an interface between the community and the public health system. Asha workers go door to door visiting the most vulnerable. They counsel couples and pregnant women. They also help with village health plans and work with adolescent and young couples by providing them contraceptives, monitoring pregnancy, and facilitating childbirth. Unlike the Anganwadi workers and Asha workers, the auxiliary nurse midwives play a supervisory role and participate in a range of health activities such as maternal health, child health, and family planning services. They also work towards improving environmental sanitation, immunization for communicable diseases, treating minor ailments, and offering first aid in emergencies and disasters. They work with health sub-centers, which provide healthcare services at the village level and are the closest service providers to the community within the health system. As of 2023, India's doctor-to-population ratio is 1:834, which means one doctor per 834 people. For many Indians living in villages, hospitals and other medical facilities are inaccessible owing to poverty, distance, and lack of knowledge, among other things. This is where the frontline health workers have a huge role to play. Because they reside in the villages or districts that they serve, they better understand the problems of the villages and are trusted by the community. Their understanding of the community and approach makes them a very important part in any government initiative directed at women and children. While it is impossible to measure the work done by frontline health workers, they have been pioneers in improving the access to health and nutritional facilities across remotest part of the country. Some of their notable contributions have included the work they have done to implement the midday meal scheme and mobilizing women to avail the Janani Suraksha Yojana, which gives cash incentives for institutional deliveries, thereby improving the chances of survival of the babies. Ensuring the proper functioning of the local health system comes with its own challenges. Low literacy rate makes tasks harder. The lack of structure in their role often confuses the priorities. There's a major lack of institutional support structure. Furthermore, there's immense workload with very limited training available. Their days usually start early and they must be available at odd hours. This places a tremendous burden on the frontline health workers and their ability to execute their tasks well. Social and cultural constraints such as caste discrimination play a huge hindrance in their path. Both caste and gender come into play while interacting with local community leaders and members, most of whom are men. There needs to be a better selection criteria for frontline health workers which go beyond their education and age. Many of the challenges faced by the frontline health workers can be solved by effective and structured training. While training is extremely important, it also needs to be followed up with supportive supervision till the frontline workers gain confidence in their skills. Last but not the least, providing encouragement, standardizing payment, and avoiding delays in the same. More respect, compensation, appreciation, and recognition can go a long way in improving the system for them to function.